So my name is Jo and I'm Head of Engagement and Experience at Leicester City CCG. My colleague Hannah is on the call as well to help answer any questions at the end of the session. So I shall do the presentation, thank you. So probably no explanations about where we are. We've been in the news quite a lot recently, but Leicester City CCG covers just the centre of Leicester, so just the city. Next slide, please. And we are responsible for buying the health services in Leicester City, so including hospital treatment, rehab services, urgent emergency care, community health services, mental health and learning disability, just to name a few there. We have about 56 GP practices, I think that's now 57, and we employ about 90 staff. Next slide, please. So the project that I want to talk to you about, we started in March 2019, and what we wanted to do was give a sum of money to, we gave it to 17 local voluntary and community sector groups with a sum of up to £2,500 to put on a health and wellbeing event or a series of events. And we had quite a strict, we were quite loose in our criteria, but at the same time we were quite clear on what we wanted people to deliver. So we said that it must meet at least one of our priorities in the CCG. It must focus on reducing health inequalities, promote independence and self-care, signpost to other free services, and engage seldom heard communities. So this was a one-off pot of money. And we really were looking for people to target some of our smaller communities, but in a creative way. So throughout the project, we managed to engage with about 3,000 people, and we had some of the most diverse and seldom heard communities engaged with our events, which is something that we would never have been able to have done if it was just the CCG alone. A number of the winning organisations have actually been able to sustain their engagement activities as well throughout the project, and they've managed to attract further funding from other sources, which has been absolutely brilliant. So the background for this is that we wrote a engagement and patient experience strategy which covered 2019 to 2021. It's slightly changing now because we are merging with our other CCGs. However, I think our needs are still the same, and we do really need to make sure that we're buying health services which really meets the needs of local people. And there's a real aim for us to be helping people to live long and healthy lives and sort of take some responsibility for their own care as well. And we do really need to find ways to help people to reduce the impact of factors such as smoking, drinking alcohol, poor diet, lack of exercise, and we have got a real mix of diverse communities in Leicester with really high rates of heart disease and CVD as well. So, as you will know, it's well known that voluntary and community sector groups can make significant contributions to improving health outcomes. And they already do provide many important preventative services that do keep people away from expensive hospital stays and frequent GP visits. So this is really where our focus for the project was. And as I've mentioned before, we've got some non-reform funding to be able to do this, so this is what we came up with. So it's quite small, and I won't focus on this, but this is just to show that we had a really robust application process and also evaluation process. So we had a contract, we asked people for a very consistent process. It needed to be really fair. We had an application form, we had lots of bits and pieces that would really help people, make it a really simple process for them. We even had a standard invoice form for people so they didn't have to go out of their way to develop something. And we had an independent evaluation panel as well, and this on the right hand side shows you our scoring form, and every single one got scored equally and fairly, and we were able to share this with people if they wanted the feedback afterwards. Next slide please. So in total, after a lot of promotion, we received 48 applications. So originally we'd only got enough money to fund 15 of those organisations. And our independent evaluation panel, nobody in our CCG were part of that, but we did have one of our lay members on that panel, and service users and carers as well, and we just didn't get involved in any of that. So the decisions were made by that group over who should get funding. And really, we were looking at the most creative ideas that we could get that really encouraged members of the public to engage in the event at a suitable and accessible time, date and venue, and as well as providing the most value for money. And of course, this was pre-COVID, so this was when things were face-to-face. So our winning bidders promoted their forthcoming events throughout their networks, which we really supported, and we promoted on their behalf as well. And afterwards, after the event, we asked them to come and just have a celebration morning when everybody had to talk about their presentation, very similar to this, but in a face-to-face environment. And just there's just some examples of some of our flyers that some of our groups have put out. So in total, we actually gave 17 grants out, so that was 2 more than we originally hoped for, and that is because some people didn't want the full amount that we were offering. They were saying, actually, we only need £1,000 to do what we think will really work. So that was great news, because we did have some really, really good, in fact, all of the applications were great, but we couldn't fund everybody. So, and it really enabled people to network, get to know each other, especially at our celebration morning, and it allowed for relationships to be built with previously engaged groups that we've got, which we still continue to this day to work with, which has been absolutely fantastic. We had some really innovative and creative approaches as well, which was great to see. And one of the most rewarding things from this piece of work is a large number of those organisations have been able to sustain their activities. Just for an example, one of our groups, which is a Hindu organisation, carried on with their yoga groups. They managed to, their volunteers put some money in, and it's something that they felt that the community really wanted, so they managed to continue. And another really good example was that one of our Bangladeshi women's groups that won some funding invited Gypsy Traveller women from another group that also won funding to attend their dance classes. So that's been really successful. And they all shared their contact details and continued to engage, and as we do with our groups as well. So I think you'll agree that this project really demonstrates how a small investment can have a big impact. So again, lots of sustainable ideas, and we were able to target populations and reach and deliver messages effectively in a way that's tailored to each community. And it was delivered by those communities rather than by us. We enlisted the support of volunteers and community goodwill as well, which is fantastic. And we definitely reported an increase in volunteers and service users as a result of the events funded by this project. And we're actually continuing to do this. So we're about to start a large-scale consultation at the moment, and we're going to be doing it in the same way because it was so successful. So one of the reasons why it was so successful, I would say, is because it really gave organisations free rein to develop their own creative ideas. Our criteria was broad, and we didn't step on any toes. We let people run them as they would want to. And the ideas came from people, local people. It came from volunteers in those communities as well. So people really owned their events. It wasn't run by us. We attended some of them, but in fact most of them. Ultimately, it was up to them what they did, and we wanted them to also be able to showcase their organisation as well. And this just gives a summary of the kinds of people that we've engaged with and the communities, and there's a really long list of sort of seldom heard and diverse communities that we managed to engage with. And when I say 3,000 people, if you look at those groups that we've engaged with, these are really diverse communities, so it's been fantastic. And the feedback we got from the groups that have been funding was brilliant. People felt it was a really worthwhile project, and it's something that we will definitely be carrying on in our CCG as we move forward. Just finally, so that I can wrap up, is that some key learning there. We said next time we'd offer tiered funding levels, which is what we're going to be doing in our latest consultation. Not everybody wants all of that money or needs it, so we said, depending on the size of the organisation, we'll offer funding levels that people can choose how much they need, and then we'll evaluate. Of course, we're going to be sharing the events and how we evaluate it as part of the information plan. We didn't do that last time, but we said next time we want to make that clear so people know how it's going to be evaluated. And again, offer a celebration event at the end. We can show your appreciation and celebrate, because that was fantastic. We had a great turnout for that, and something that we're really glad that we did.